Why do stroke patients experience apathy with depression? Imagine waking up after a stroke and feeling like your motivation and mood are both gone, but for different reasons. That's often what happens with stroke survivors who experience both apathy and depression. These two conditions can seem similar but are actually quite different in how they affect the brain and emotions. When a stroke occurs, it can damage specific parts of the brain that control how we feel and how motivated we are to act. For example, damage to the frontal lobes, basal ganglia, and limbic system can interfere with how the brain processes rewards and initiates actions. This disruption can lead to apathy, which is a lack of motivation and a reduced drive to pursue goals, even if the person does not feel sad. At the same time, the same or nearby brain areas may be involved in depression, which includes feelings of sadness, hopelessness, and a loss of pleasure. So, while both conditions can happen together, they stem from different but overlapping brain circuit problems. Post-stroke depression is now understood to include two main types, one where the person feels emotionally low and another where they simply lack motivation without necessarily feeling sad. This makes diagnosis tricky because a person might seem indifferent but also be experiencing feelings of despair. Physical disabilities caused by stroke can also play a role. When someone loses their ability to do daily activities or feels socially isolated, it can trigger emotional responses like frustration and sadness. These feelings can deepen depression. At the same time, the disabilities might make it harder for the person to stay engaged in therapy or daily routines, which can lead to apathy. When motivation drops, it becomes even more difficult to recover, creating a cycle that worsens both apathy and depression. Cognitive issues are also common after stroke, especially problems with planning, attention, and memory. These cognitive challenges can make it harder to start or stick with activities, which can contribute to feelings of indifference and low mood. Interestingly, apathy can sometimes come before depression or make it worse, because if someone is not motivated to participate in recovery, their mood can decline further. Apathy can also increase the risk of suicidal thoughts independently of depression, highlighting how serious and complex these issues are. Sometimes, apathy might serve as a psychological shield, helping the person avoid emotional pain caused by their losses. It's a way of detaching emotionally to cope with the stroke's impact. But whether it's a protective response or a symptom of brain injury, it often coexists with depression, and both need different approaches for treatment. Recognizing the difference is key because managing apathy might involve strategies to boost motivation and engagement, while depression often requires emotional and psychological support, sometimes with medication. In the end, the reason stroke patients experience both apathy and depression is because brain injury affects the circuits that regulate motivation and emotion. The physical and emotional challenges of recovery, combined with cognitive impairments, make these conditions common and complex. Addressing them requires a comprehensive, personalized approach that involves medical professionals, therapists, and support systems to help improve motivation, mood, and overall quality of life. If you or someone you know is dealing with these symptoms, it's important to seek advice from healthcare providers who can tailor treatment plans to individual needs.